Have you ever struggled to get enough oxygen? Now, for some people, that may sound like a strange question. But for millions of Americans and millions more throughout the world, this is not a strange question at all. I'm Dr. David DeRose, a specialist in internal medicine and preventive medicine, and your host for a program called Improve Lung Function Naturally. You see, throughout the world, many people are struggling with conditions like asthma, chronic bronchitis, emphysema, and there are days or weeks or sometimes lifetimes where people are struggling to get their breath. The good news is there is evidence that we can use natural therapies to improve lung function. What's even more exciting to me as a physician is this. There are many people who have mild lung impairment who are unaware of it, and they too can benefit from the strategies that we share in a life-changing LifeStart seminar. That's right. What I'm talking with you about is an amazing program. It's called LifeStart Seminars. You can access them at lifestartseminars.com. And in this particular presentation, we will talk about asthma, and we will talk about chronic obstructive lung diseases. Let me just give you a little bit more of an overview about these conditions. Asthma is a condition where the airways are overly reactive. They tighten up at the smallest of provocations. What we're learning is that dietary factors, air quality factors, these things have some profound impact on whether or not a person with asthma can go along with an even keel just breathing normally, or whether it triggers an asthmatic reaction. For example, did you know that typical dietary patterns actually have a role on lung function? A very recent study revealed that people that eat more plant products, follow a Mediterranean-type diet, if they have asthma, they will be much less likely to have asthmatic attacks. Isn't that good news? Liquids also have a bearing. In this presentation, I tell you that there are some problems with caffeinated beverages, alcoholic beverages, because they interrelate with some digestive problems, that's right, digestive problems, that can actually trigger lung function difficulties. Are you aware that millions of Americans have heartburn? And although that may sound like an innocuous condition, heartburn with the acid reflux, acid coming from the stomach up into the esophagus, can then go down into the lungs and can trigger airway spasm. We have insights into that and how beverages can make a difference. We also speak about hydrotherapy, water treatments that actually can help with asthma and other lung problems. So all of this comes packaged in something called Improve Lung Function Naturally. I can't not tell you about one of the things that we can't avoid speaking about when we speak about lung function, and that is cigarette smoking. If you have a lung problem, there is absolutely no substitute for getting the cigarette smoke totally out of your environment. If that's discouraging, we've got other resources on the LifeStart website that can help you, but I want to encourage you to step out and join me for my presentation on improving lung function naturally. It is a life-changing presentation. It will give you simple, natural things to do that can help you, whether you've got asthma, whether you've got chronic bronchitis, which is causes a chronic cough with productive material, you're coughing up sputum, or whether it's emphysema, which is a condition where the elastic fibers in the lungs have been destroyed. There is help, it's available, and it's there for you at lifestartseminars.com. I'm Dr. David DeRose, and I'll be looking for you to join me for my half-hour presentation, Improve Lung Function Naturally, at lifestartseminars.com.